Hello, I'm Dr. Saritha Bangara, Assistant Professor of Public Health and Co-Director of the Public Health Program here at Austin College. Thank you for joining me for this important video with information to help keep us safe and healthy. The reason why I've taken off my mask for this video is because I'm adequately socially distanced from the people that are recording the video. I will cover 4 important topics today, which include daily health screens, COVID-19 is on our campus and what are our campus protocols, the dashboard and what exactly is the difference between quarantine and isolation, and the consequences of all of this. Let me begin by saying that we are not surprised by the arrival of the highly contagious COVID-19 to our campus. The college has taken every precaution and provided information to help prevent widespread illness. But for any of that to work, all members of the community must do their part. We intend to continue with on-campus classes and we commit to wearing masks in all buildings and outside, keeping at least 6 feet of distance between us, frequent cleaning, yes, washing our hands with soap and water for at least 20 seconds, and when soap and water is not available, using hand sanitizer with at least 60% alcohol, and also cleaning all surfaces around us. About the mask, there's a right way and a wrong way to wear them. You have to cover your nose as well as your mouth. Don't touch the inside or outside of the mask itself. And remember to wash or replace it after wearing it at least every day. So let's begin with our first topic, daily health screens and pass for entry. We start each day with a daily health screen using the Austin College mobile app. You click the Healthy Return to Campus tile on the app and report any symptoms, and report if you've been in contact with a test positive case of COVID-19. Then tap Submit. That's it. It's really simple. Go to your profile to access your green or your red badge. Now, students need the green health pass to gain entry into classes, the cafeteria, and the pouch club, as well as to participate in campus activities. We are keeping the campus as closed as is possible for visitors. Approved visitors such as vendors and prospective students with appointments will be allowed on campus. They report to the welcome station at Wortham Center to be screened for symptoms, and then they're given a wristband as a pass for entry. Students should not be inviting guests to campus from outside the college. And while we are closed to most visitors, students are expected to stay on campus with proper distance safety. You can go into town for doctor's appointments, needed shopping, and work. You can pick up meals from local restaurants or enjoy a meal outdoors at their locations. However, stay safe and do not eat inside a restaurant. It is not worth the risk. And stay safe while working out, especially indoors. And wearing a mask is perfectly fine and healthy. It allows you to breathe when you need to stay fit. It is very important to wear a mask even when you're using a campus or a public restroom. However, what about parties? Just don't. Do not host them. Do not attend them. Attending gatherings and socializing without masks brings the COVID virus closer to our homes here at Austin College. So those are some preventative measures, and now we're going to discuss some terms. Topic 2, COVID-19 dashboard, isolation, and quarantine. The college has a weekday reporting schedule on the COVID-19 dashboard. It is a good place to keep track of the overall COVID situation here at Austin College. It is only a snapshot of aggregate data and privacy guidelines apply. It is always our intent to make sure your information is not disclosed or intentionally made public. So what is isolation? Isolation is when we separate a symptomatic or test positive individual from other people. The student may have been assessed as test positive for COVID-19 by proper healthcare authorities such as the Director of Health Services or an authorized COVID-19 testing center. No matter who administers the test, Austin College Health Services will verify each student's test and work with them to find a safe and comfortable place to isolate. Now, you cannot leave isolation until you're cleared by health services. No one self-isolates, so it's important to communicate with health services if you're not feeling well. Students in isolation are restricted from having visitors and from going onto campus for anything, such as classes, at the dining hall, a walk down Windsor Mall, and they should not go into the community. Whether they're experiencing symptoms or not, they are required to stay in isolation. If on a meal plan, students will have meals brought to them by campus staff. If not on a meal plan, students will work with Student Life to make arrangements. Now, students are supported by health services the entire time in isolation, and those in isolation can resume their studies remotely as soon as they feel well enough. No student who is sick with COVID-19 will be penalized for absences while they recover. So we talked about isolation. Now, what is quarantine? Quarantine is when we separate a person who has definitely been exposed to a test positive case. Austin College Health Services will verify the exposure and assign the student to enter quarantine and clear them to exit quarantine. Again, no one self-quarantines, so it's important to communicate this information with health services. Now, just like those in isolation, students in quarantine cannot have visitors and they cannot leave their quarantine room. Even though sometimes students feel well enough in quarantine, they are required to remain there until released by Austin College Health Services. Meal arrangements are the same as if in isolation. Students are supported by health services the entire time in quarantine and are able to access their classes remotely. So now we're talking about a different topic, which is contact tracing. Contact tracing is a method used to find and follow up with people who have been in close contact with someone who tested positive for COVID-19. One tool that we have here on campus is the QR code check-in via the Austin College mobile app. In this app, you use your camera as you enter buildings and rooms within buildings. People who've been around the test positive case and potentially exposed to COVID-19 are called close contacts. Now, by tracing the contacts of COVID-19 cases, we can assign them to quarantine, recommend testing if warranted, and ultimately this is going to help contain the spread of COVID-19. What is a close contact? A close contact is anyone who has definitely been exposed to someone who is a test positive case of COVID-19. Someone who's identified as a close contact would be required to enter quarantine. Now, a few examples of a close contact is someone who has been within 6 feet of someone with or without a mask for more than 15 minutes. They can be roommates, a study group sitting closely at one table, or someone seated less than 6 feet away from a classmate, unmasked friends having a long talk on an outdoor bench. Now, who does not qualify as a close contact? Passing in the hall, a short visit while outdoors and masked, begin in class or doing activities where everyone is masked and practicing physical distancing. This is what we do to stay safe. Wear masks in all buildings and outside, keep 6 feet apart from one another, wash our hands frequently, and cover our coughs and sneezes. And if we're assigned to isolation or quarantine, stay there. Now, what happens if a student does not comply with COVID-19 protocols? Simply put, it is disciplinary action. A student who does not observe any campus safety protocols, including isolation and quarantine, will be referred to the Dean of Students for disciplinary action. If the situation persists, the student may be sent home or to another location off campus. Students who host gatherings that promote violations of proper distance protocols, this is failure to comply. Stay healthy this semester. Read your emails from professors and health services and respond to them. Failure to respond to a directive from health services is quite serious. By working together, we can stay together here on campus. Now, anyone who refuses to comply will be removed. So questions. Call health services if you're sick or symptomatic. I will be having office hours Zoom videos on Thursdays at 10 a.m. to discuss these topics and to answer any health-related questions. Check the Austin College website. The COVID page has frequently asked questions and many resources. Thank you very much for watching. I know we would all like to continue in-person classes and remain together as a community on campus. In order for us to do so, it is incumbent upon each one of us to maintain the same level of vigilance to mitigate the risk of spreading COVID in your social lives as you do in the classroom setting. And once again, this includes mask wearing during social interactions, not gathering in large groups, and frequent hand washing.